Guess what we've got coming down?
Oh, what?
A lace monitor.
A what?
A goanna.
Goanna.
Yeah.
It's coming down.
Yeah, just got a phone call. This guy is a pet goanna that's been attacked by one of his bigger ones. So the one that attacked him was probably about that big, and the one that's coming down, the one that's coming down is probably only about 1 kilo.
It's pretty bad. It's a couple of centimetres deep and all across from one side to the other.
Peter has a collection of 20 goannas at home, and one of the larger family members has attacked the much smaller 5-year-old Bally.
To be honest, I am a little bit scared of reptiles. They give me the creeps, and treating or handling one of these is a bit of a nightmare for me.
Hey, little one.
You can't really trust them. I've been bitten by her actually a while back when she was smaller. I had to go to hospital for that.
I'm going to actually, if you don't mind, take her out the back and get Jess, our nurse, to help me get that bandage off, and we can take a look.
We're supposed to learn about all animals at uni, but quite honestly, all I can remember about lizards and reptiles are a few lectures we had back in 3rd year.
Yeah, if you can be comfortable that you're going to hold her and that she's not going to bite me, because honestly, I don't deal with reptiles very often, and I'm instilling all my faith in you.
Okay.
Okay.
I used to work up at Australia Zoo, Wildlife Hospital, and we did a lot of lace monitors up there, wild ones, so I don't have a problem with a pet one. They're really cute as babies. Very, very cute. So they're just misunderstood. It's the claws and the tails that you need to watch out for in these guys, not necessarily their mouth.
All right. Now, her tail, is there a spike?
No, they flick it really, really hard.
They just flick it hard.
Yep.
Okay, so I'm just going to get like bruised from that and scratched and shredded from the claws. Fantastic. I'm a bit nervous. I'm looking.
I've got him.
I'm looking at his claws.
Bally the lace monitor has been savaged by one of the huge goannas she lives with.
I don't even like the feel of this.
But before Lisa can treat the severe wound, she wants to give Bally a general anaesthetic. Finding the right spot is proving extremely difficult.
Oh my God, Steph! It's not the easiest thing to do because you can't really see the vein. I guess if I was taking blood for a dog or a cat, I could feel the vein and I could see it. Here we're kind of going in blind.
There it is.
Yay! How good is that?
And then just hold it.
Woo! I anaesthetised a lace monitor. But maybe the first and last time. Right, hon, just take some deep breaths. Talking to a lizard here. Look. Oh, she's really been ripped to pieces here. I see all the flesh and muscle right underneath there, so that big lace monitor has obviously come up to her and just taken a chunk out of her neck, and this needs to be stitched. I guess the main thing that I'm concerned about is infection. Goannas have got really nasty bacteria in their mouth and in their claws, and that bacteria can almost be venomous. It's that bad. So if we don't stitch up this wound and get her on some antibiotics, she can die from septic infection. How far down would I go? We've got to work pretty quickly here because they're obviously very sensitive animals, very prone to stress.
Bally the lace monitor has had her neck ripped open by a much larger goanna.
The muscle under there is really shredded. The good thing is it doesn't look like it's gone through to her spinal cord. If it had, she would probably be paralysed, but I really need to fix up this shredded muscle and treat any chance of infection.
Even though these reptiles freak me out a little bit, looking at Bally, I actually feel quite sorry for her. She has been bullied by a big bloke and she has copped a terrible bite.
Thank you. All right, here we go. Her skin is really thick and tough, so I need to use a very thick suture material in order to close that wound. In a dog or cat, I would use something a lot finer. I'm trying to do neat ones so that she still maintains her attractive looks. And we're done.
Anti-inflammatory and antibiotic injections finish the lace monitor's treatment.
So just before she wakes up, did you want to give her a bit of a kiss on the nose?
I can't. I can't do it. You do it.
No?
Come on, kiss goodbye. important for me to see her moving like this. It emphasises the fact that there's no damage to her spinal cord and she's recovered well from the procedure. I think now we'll pop her back to bed to wake up more. I'm feeling pretty chuffed with myself now. I think that all went very well. If another one came in, yes, I would treat it.
While Lisa is congratulating herself on controlling her fear of reptiles, vet nurse Jess is still not convinced.
Oh my God. You are evil, all of you.
She's still a princess until she kisses a toad.
You should be telling me how brave I was. I was so brave. Okay, all done. She was very well behaved.
Belly's going home after surviving an attack that nearly tore her neck apart.
Bye-bye. Who knows, maybe I'll become Sasha's resident lace monitor specialist. There's my role. But I'll never kiss one. That is never, ever, ever going to happen.
So Belly's in this one.
Yeah, Billy's in here.
A few days later, vet nurse Jess visits Peter's Reptile Resort to check up on Belly's progress.
It's a bit of a size difference here.
The patient is being reacquainted with Big Rex, who nearly tore the lace monitor's head off.
He's having a bit of a taste there.
Yeah.
Don't want any fighting going on here.
They're cold?
Yeah, oh, he's not very happy, is he? She's incredibly lucky. I think she should buy the next lotto ticket, maybe.
I'm Dr. Kate Adams and welcome to Bondi Pet, a new destination for pet health and well-being. Our site is filled with everything to fulfill your pet's needs so that you can make healthy choices for your pets.